Hi, I'm Sarah, and today we're going to demonstrate intramuscular medicine administration, also referred to as IM medicine. I'm using a tomato for demonstrative purposes just because it really does resemble the flesh very well, because it's kind of got a hard exterior and then the inside absorbs the medicine well. Something to remember is you want to make sure that you have the right medicine. Today we're using Zofran. Things on the truck that we use for IM medication is Zofran, sometimes morphine, definitely always an allergic reaction when there is any kind of anaphylaxis occurring. You use Epi 1-to-1. Today we're going to use Zofran purposes, so this would be for a patient who is currently having nausea and vomiting. This would be, say, for somebody that you don't have IV access for different reasons, such as very poor veins for anything. Maybe they're too dehydrated to get a vein. Maybe they're going through chemo and they have really poor veins, or you just can't see any. Sometimes it's just difficult to obtain. Maybe you've tried 3 times to obtain a IV and you can't, but you still want to make sure that that patient gets that medicine. So when picking the medicine that you're going to choose, first of all, make sure that it is IM use. Usually on the bottle, it will say if you can use, down here, if you can see, it says for intravenous or intramuscular injection. On all of the bottles, it will say if you can use IM, IV, or if it's just IV purposes. So make sure that it is the right medicine. You want to do the right dose. This is 4 milligrams. That's a standard dose for Zofran. If it is a pediatric patient, make sure to refer to your Broslow tape to see that it is the right dose for that. But so you get the right dose, you want the right medicine, nausea and vomiting, we're going to use Zofran. The right patient, hopefully that's not an issue for you unless you're in a mass casualty situation. However, that is a whole nother ball game that we won't talk about right now. And you want to make sure that it is in date. Currently, this is not in date, and we're just using this for demonstrative purposes. But definitely make sure that it is within date. And you want to give it at the right time. This one's not so particular about that because it's for nausea and vomiting. However, there are different medicines. If you don't want to give Epi, for instance, to somebody who is over 65, who has a history of heart problems, because that could cause other stuff, unless they're in true anaphylaxis. And if that's the case, then you get a 12 lead before, but that falls under the anaphylaxis protocol. So you want to make sure that you have all of the right stuff that you need. Today, we're going to use the alcohol prep pads. We're also going to use a 3cc syringe. I have one already set out just because I already prepared it for this, but make sure to use a sterile needle each time. And if something happens, like maybe you have the wrong injection site, you discover something is wrong, make sure to use a good clean needle after each use. So the injection sites for IM is the acromion process, which is above the scapula. The scapula is back here. And so you want to make sure to go down below the shoulder. A good rule of thumb to use is that you do 2 fingers right there on that ball of the joint, and you go right under that, and that's right there in the deltoid muscle. So that's something important to use. Also, you can use the hip. That's also a common one. A good rule of thumb for that is you stick your thumb right there on the hip, and you fan your fingers out along the buttocks, and you go right in between where that is, right there. But you have to be careful there, only because there's a lot of nerves there. That sciatic nerve is there, and if you hit that point, they're going to tell you, and it's going to hurt, and it's not going to be a fun thing. You can also do in the thigh, like you would an EpiPen, if they're having an allergic reaction, and that's right in there. You want to make sure to get where there's a lot of muscle in there. So first of all, you're going to undo this, I apologize for the background distraction. I am doing this obviously in my kitchen, and I have a 2-year-old, a 14-year-old, and a 15-year-old. So you can just act like there's a lot of outside distractions like you would on any other call. So I have undone this needle out of the packaging and opened the needle out of the packaging. So we're going to uncap it, make sure it's twisted on. That happens a lot. There you go. But we're going to uncap it very carefully. And we're going to put it down into the medicine. You can either, I'm going to show you what to do. You don't have to do this all the time, but you can put air into this for the dose that you're going to give, just because there's a vacuum seal inside of this and it helps the medicine go in better. And you push the air in, and then you're going to flip this up. Make sure that the bevel of this needle is below the line of the liquid, and draw it up. With that vacuum seal, it kind of automatically draws it up for you. You just kind of make sure that it's going at the right thing. So once you have that medicine in there, I always flick it just to make sure that there's no air bubbles in there. And then you depress the plunger to make sure that you get all of the air that's in there out, and it's ready to go. Then cap it back just so that way it's safe, and put it down. Then you want to prepare the site. Always make sure to have PPE. Technically, it's not in protocol that you have to have gloves for an intramuscular site. However, it is a good idea, because the general rule of EMS is if it's wet and sticky and not yours, you don't want to touch it. I do not have gloves because I'm at my house, but it's a good idea to have that. So you want to take this alcohol prep pad. A side note about this, just joking. So a side note about this is some people use iodine prep pads, which is good, and it disinfects very well. However, there are a lot of people who are allergic to shellfish and iodine. So when you're asking your sample history and somebody tells you that they're allergic to shellfish, make sure that you do not use iodine for that patient. So we're going to take this alcohol prep pad, we're going to open it, and we're going to prep the site. So whether you choose the deltoid or the hip or the thigh, it's up to you. However, we're on an ambulance. Most of the time, you're not going to be able to get to that area on the buttocks if you choose that, and even the thigh is difficult. So for me, at least, and all the time that I've been doing this, the deltoid is the right way. And a good rule of thumb is to use their non-dominant hand, just because it could be sore afterwards. So just kind of as a courtesy to them, use their non-dominant hand, especially if you're only going to do one dose. If you were going to do repeated doses, such as if you were to do morphine, and maybe you called medical direction and you said this patient doesn't have an IV, but they need repeated doses of morphine, and they gave you that okay to do that, make sure to switch sides. Don't do it on one spot every time. That's not fair to the patient. So now we're going to prep the process. We're going to prep the area and do it in a circular motion, and then just do one swipe kind of where you're going to do it to make sure that it's good and ready. Then you get that medicine again without losing too much medicine. Make sure that there's no air. You don't want to add air into that. Stick the needle in. You want it to be long enough to where it reaches inside that muscle so it's well absorbed, but you don't want to go so far that you hurt the patient or jab something that you don't want to jab. You can just a little bit pull that plunger back just to make sure that there's no blood. If you see blood flow in there, that means that you're in a blood vessel and you're not in the right place. we're going to pretend like this is the deltoid area. And so we've put it, that 2 fingers down past the chromium process, and we've drawn back and there's no blood flow. So we're going to slowly depress that medicine in there. And as you see, which is totally normal, there's like an air embolus type thing in there. So we're going to push, but we're not going to add that air in there because we don't want that to get into the patient's muscle. So we're going to stop right there. And as you can see, I don't know if you saw that, but it tends to squirt out. So immediately block that area with a gloved finger so that no medicine comes out. And you want to massage that area. I'm going to use this because I just tend to use that as it is. And you want to massage that area. There might be a little bit of a bubble there. That's natural until it absorbs it. And if you rub that out kind of firm, it helps that muscle absorb. Something to remember is that the intramuscular is actually the slowest, aside from oral medicine, to absorb. So if they don't feel relief in 2-3 minutes, don't be alarmed. That's just natural. Make sure that you recap. Whoop, just joking. I got it, but you want to recap that needle for safety purposes and dispose of it in the proper place in a sharps container. So if there's bleeding, that's normal. You just want to make sure to rub it out and put a Band-Aid over it. You also want to check them every 5 minutes, especially if it's a new medicine they've never experienced before, to make sure that there's no allergic reaction when it comes to that. So something to look for adverse reactions is maybe redness at the site. There will be some, but you don't want to see a large amount of redness. If they start having any sort of breathing difficulties, you definitely want to make sure that you start doing your allergic reaction protocol. Also, if they need repeated doses, like I said before, you want to make sure to put it on a different site than you did before. So after you administer this, check that area, especially if they've never had that medicine before. You want to document correctly the right time, the right dose, the right medicine that you gave, and make sure to put where you put it in. And then if they're going to have an allergic reaction to that medicine, it will usually happen within 30 minutes. And then you can deal with that appropriately. So again, I am sorry for the 2-year-old tantrums, but that happens. So make sure afterwards that you document, like I said, document. If you didn't document, it didn't happen, what happened, as well as how the patient reacted to that. Did their nausea improve, which is what we're looking for when it comes to this Zofran administration? Or did it get worse? Or did they have any sort of reaction? So that is my presentation for today. Make sure to dispose of everything properly and encourage your patient along the way. It may hurt and the patient probably will not like you while you're doing it, but just talk them through it and say, look, I know that this hurts. It's not a fun thing, but it will help you feel better in the long run. And usually they react very well to that. So that is all of my presentation, but I still have a couple minutes to spare. So, also make sure that it's a medicine that you're allowed to give. If you are not allowed to give that medicine, it's not in your scope of practice, do not give that medicine. Or if it's deviating protocol, a lot of times with morphine, it's best to call medical control and say, listen, this patient is a 250-pound person, all vitals are stable, But the protocol for morphine is technically you give 4 milligrams the first dose, and then you give 2 milligrams 5 to 10 minutes after that, and 2 milligrams 5 to 10 minutes after that, and then another 2 milligrams. Well, if you're giving injections at that patient's not going to like you very much, and it's not going to be pleasant for that patient. So call medical control and say, look, I've got 250-pound patient, all vitals are normal. I'm unable to obtain an IV access, but I feel like that patient needs a lot of morphine, not a lot of morphine, but more morphine than 4 milligrams at one time. Medical control is great about, they will say, okay, give one 5 milligram injection followed by another 5 milligram injection 10 minutes later if their vitals sustain. And so that's a good way to do it. Don't torture that patient giving repeated doses in different spots when you can give them more at one time if they're stable enough. So that is all I have for you, and I hope that you learned something. Thank you.